Well, good afternoon, everyone. This is Daryl McNair with Colonial Gardens Alzheimer's Special Care Center. Today we are doing a segment on dementia situations, and I am being joined by our friends over at Lisa's Care Connection. So I know Marty and Keena, they are there. We are going to try to see if we can connect them, so bear with me as I stick my finger in the screen. It does. Oh, my viewers. Let's see who my viewers are. This is something new that we're trying here. And it appears. Oh, there they are. Let's see what it says. Marty is watching. Well, I'm trying to connect Marty in, and it does not appear that I am able to do that at this time. So, they just told me I was sideways also, so sorry about that. And now I believe they're probably laughing at me. Well, we're going to go ahead and try to get started with this, even though I am unable to get them to join us here at the moment. So here we go. So as you know, a lot of times we'll stop over at Lisa's and see if we can talk about different situations that occur. But with this whole COVID-19 coronavirus thing going on, we figured it would be a good time to talk about the situation of, oh my goodness, I have someone that's in a facility somewhere, and what changes are going on in those facilities. Quite frankly, the changes have been ongoing for the past week. We have seen 2 or 3 changes in the government or with some of the health organizations like the CDC or DHEC or the World Health Organization. And so we facilities are trying our best to do what we can to keep up with those changes. So what are some of the things that you might be asking? Well, talking with some of my other colleagues out there in the facility world, some of the questions that we have heard so far are, how is it that a facility can prevent me from seeing my loved one while they are in the facility? I'm the power of attorney. How is it that I cannot see them? Well, unfortunately, those guidelines are not set by the facility itself. For example, it's not Colonial Gardens trying to be mean. It is actually the fact that we are going by guidance from the CDC and the World Health Organization and DHEC to try our best to do what you have asked us to do. And that is keep your mother, your father, your uncle, whomever, safe. And with this concern at the forefront, we unfortunately have to restrict the visitation of individuals coming in our building. So, how is that going to help our loved ones? Well, a lot of times what we might see is if I happen to run to Bojangles and pick up something to eat, I might accidentally come in contact with someone that I don't know might have symptoms for this nasty virus. So the last thing I would want to do is run there, come back here, and bring that to our residents. Same thing applies to, unfortunately, you all. If someone were to come and visit, either a loved one or even someone from an agency, such as the folks from a hospice or a home health agency, a physical therapist, if they were to come in after going to another facility and someone there may have contracted the virus, the last thing we would want would be for them to come here and bring it here as well. So we are doing what you asked us to do, and that is to keep mama safe. Now, another question we've heard. What are some of the tips for caregivers or loved ones who have someone in an assisted living facility or a skilled nursing facility? What are some of the things that we can do so that we don't fret over whether or not mama's getting good care. The first thing that you should do is give a call to the facility. Ask what are the procedures of the facility for managing the COVID-19 virus and the risk that it poses. You also want to ensure that the facility, and this is probably going to be the most important tip that I can give you. What is as far as the most important tip would be, ensure that the facility has your current, if you are the POA, if this loved one is someone that you have the power of attorney over, make sure the facility has your updated information. Things change from the time that you first place an individual in a facility. We want to make sure that you have your information updated with the facility. The second thing that is probably most important is that you want to make sure that there is a backup person set up for this this contingency plan, if you will. Because if something happens to your loved one here and we're unable to get in contact with you, we want to make sure that we're able to get in contact with somebody else who can find you. That is so important. So please call the facility and give them your updated phone and email address. So it looks like we have another question from the audience, and that question is, how can we connect with our loved one if we can't physically see them? Well, I'm sure you've seen a lot of things on TV lately, on the news or on social media, stating where people are going to the windows and sitting back and calling mama from outside the window or talking to them from outside the window. Well, that works well, but also don't forget, technology is wonderful. We're connecting with you right now through Facebook Live, but there's also things out there such as Zoom or Skype or some of the other social media programs out there will allow you to connect with your loved one, so they can see you and you can see them, and still wish them a happy birthday, happy anniversary, and of course let them know how much you love them and how much you miss them. So it looks like we've had a few more folks log on here. So hey Marcia, and of course hey Keena. What other questions might you have out there? Another one that I see that's, let's see, we have another question here. Do facilities have iPads to connect us? Some facilities do have those set up as a provision. And that is another question. The big thing here to remember is to make sure you give a call to the facility and ask them what procedures do they have? What will they be able to provide to you so that you can talk with your loved one? Another question here, but how can a facility make policy changes and not notify us as a family member? That's a great question, and I've heard that a couple times myself here. Here's the kicker with that. Policy changes, if you recall, are made through the guidance of the CDC and the World Health Organization. You'll see that a lot of times written down as WHO, capital letters, WHO. So, as these changes occur, we're making those changes here at the community. And we try our best to get those out to you. Unfortunately, sometimes, especially because this is a ever fluid thing going on, sometimes those changes come so quick, we're unable to get those changes out to you. Hopefully, the facility is either sending out letters with final changes before they change again, or sending out emails so that you're aware. So, great questions, folks. Well, we were set up for about 15 minutes, and we're coming close to that 15-minute mark. So what I'd like to ask you to do, if you have another question you'd like to type in real quick, let's go for one more question. If I don't see it pop up on the screen, we'll go with one on my sheet. Not seeing one on the screen, so what we'll do is we'll move on. Let's see. Here's one. And this is something that I want to make sure that you're aware of. A couple more questions are coming in now. One thing that you can do is, if your facility where your loved one is still allowing folks to come in, which I don't believe they are right now, you want to make sure that not only are they washing their hands, they being the facility team, and I'm sure they are, but you want to make sure if you're dropping something off for your loved one, you want to make sure that you wash your hands before you handle it. You want to clean off that item thoroughly with something that's alcohol-based, and they're saying 60% alcohol for some of these hand sanitizers and the sanitizers that you're using. But you want to make sure that you clean the item off prior to taking it there. Mind you, the facility may not allow you to drop those off. One last question here, or one actual statement that Marty asked me to make, is that Lisa's, of course, are collecting cards for caregivers. And, of course, I'm sure they wouldn't mind helping pass those cards on to communities as well. Oh, I see one more person slipping in a question. Keena, Marty, I hope you don't mind. I'm going to try to answer this one too. The question is hospice allowed when family is not? Again, you want to check with your community, with the facility, and see what their procedures are. Many facilities right now are allowing hospice nurses to come in because for a person to be on hospice, there are certain Medicare procedures that need to, or regulations that need to be followed. And so those are being followed. Some folks are allowing nurses in for their every 14-day regulatory visit, and others might be allowing them in even further. So please check with the building itself to see what those procedures are. That's probably the most important tip outside of what I mentioned to you earlier. And of course, Lisa wants to make sure that everyone knows how grateful Lisa's Care Connection is, and how grateful all of us are to all those healthcare workers that are out there, and you, the caregiver. Of course, this is a stressful time for you as well. We appreciate you too. Know that you can still call Lisa's Care Connection, and people are going to answer your call and get back with you. Don't be stressed. Don't be anxious. Please realize we're all going through this together, and even though we might not be able to touch one another as we usually do, we still love you, and we still want to work with you, and we're still there for you. God bless you. Keep the faith. Keep strong. Keep washing your hands, and know that we're here for you. Thank you all. We'll talk to you later. Be good. Be blessed.